Well, looking ahead now to May 3rd, a very special day and tremendous resource here for Southern Colorado, but the deadline to apply is fast approaching. Of course, we're talking about the free hand surgery day. With us right now is hand surgeon Dr. Jeffrey Watson and Chelsea Valerio. Valerio, is that right?
Yes.
Okay. Sorry about that. From the Colorado Springs Orthopaedic Group, good morning to you both.
Good
morning.
Thanks for being here. So for those who don't know, tell us more about this event, the Hands Helping Hands Project.
The Helping Hands Project was an initiative from an organization called the American Society for Surgery of the Hand, where we've done international outreach for many years, and there is the obvious issue of our own neighbors for all of us across the country.
Okay.
So there was an initiative to start helping the people in our cities, our neighborhoods, and communities. Hand surgeons across the country started hosting what we typically call free hand days.
Sure.
And through the Touching Hands Project, and it's an opportunity to offer surgical care to the upper extremities for patients that have access issues, and usually it's those who don't have commercial insurance, and to patients with Medicaid as well. And we take this opportunity to offer procedures that can be done at a single outpatient setting.
Okay.
And
So with that said, what type of surgeries will you do during this time and not do?
So we are looking for an opportunity to make a difference with a single surgery day, and so that entails a lot of people who are living with issues such as nerve compression, what we often hear called carpal tunnel syndrome or cubital tunnel syndrome up at the elbow. And a lot of times patients don't know which. It's up to us to help them help determine this.
Okay.
And some people have fractures that never healed, that they just haven't been able to get access to have them seen. Some people will have tendon problems like trigger fingers, a lot of tendinopathies around the wrist or the elbow.
Okay.
And so those are things that we can make a difference on for people. We can't treat things that are going to require multiple stage procedures in this kind of venue, or sometimes things that are truly medically complicated that we're not going to be able to accomplish safely in an
So those who have
outpatient
this
setting.
treatment, they know something's wrong with their hands. They just don't know exactly what's wrong. And
Yeah, they're like most of us. They know something's wrong, and we try to bring the patients in and screen them, and because again, patients don't know. They know something's wrong, and it may not even be a surgical problem. That happens all the time. We'll see patients and just tell them, hey, you don't need anything. This is probably going to get better.
Okay.
Yeah.
So what's the demand for this, and how impactful is this for someone looking for help, and how can this pretty much change someone's life?
Yeah, so we see a lot. This event is specifically for those who are uninsured or on Medicaid recipients. So, you know, with that population as well, trying to find affordable access to care is extremely difficult. So that's how we're trying to make that change too, is like, hey, come see us. Let's get you fixed. Let's get you back to what you need to be doing. A lot of them are the people who work with their hands all the time, and you know, but they're dealing with it in pain. So if we can help get them back, that's what we want.
Yeah, what a great life-changing resource again. And by the way, your care doesn't just stop after a surgery. Now, you might not need, of course, more surgeries, but you do have post-op treatment as well, right?
Yep.
Correct. We have to see it through, and some things require therapy, which a lot of times it's just us showing people what to do and they're able to accomplish on their own, but sometimes people need a little more than that depending on what they're having done. Yes.
Okay, let's talk about that deadline. It's fast approaching now, and who is not covered for this event.
Absolutely. So the deadline for registration is going to be Sunday, April 13th. Midnight, so at least gives you all Sunday. But then the surgery day will actually be May 3rd. So that gives us a couple weeks to prep appropriately, make sure everybody's good to go. And then again, it's for those that are uninsured and also Medicaid recipients.
Okay, good stuff. Doctor and Chelsea, thank you so much. 2025 Free Hand Surgery Day. Thanks for what you're doing. We appreciate that.